Good morning and welcome to Radio Friends on Monday, May the 13th. Pleasure to have you with us today. You may know that May is Skin Cancer Awareness Month, and I want to introduce you to Dr. Emily Smith, MU Healthcare. Good to have you with us, Doctor.
Hi, thank you for having me.
Skin Cancer Awareness Month, you want to get the word out to as many people about screening that Ellis Fischel is featuring, right?
Yes, absolutely. So Ellis Fischel Cancer Center is going to be hosting a free screening to the public. It's on May 23rd from 3 to 6 p.m. at Ellis Fischel Cancer Center. Anyone is welcome to attend. We do recommend you call and have a reservation,
but it's free.
It's free.
So what do you do when you go in for the free screening? Is this a full body screening that you do?
Good question. No, you come in and we'll look at exposed skin. If you have a spot that happens to be beneath clothing, we can get you a gown, or if you wear an appropriate piece of clothing that'll help us to see the spot easily, then that works as well. We'll look at any spot you're worried about. They're in closed private rooms, and so you don't have to worry about others.
And it doesn't take very long, does it?
No, very quick, very quick.
What are you looking for when you're looking for skin cancer?
We look for lots of different things, and skin cancer has many different faces. If you have a spot that's been a sore that doesn't seem to be healing, a pimple that doesn't go away, those can be things that we want you to look for. We look for something called the ugly duckling also. That can be a really helpful feature. So if you have something on your body that is new and different and looks like nothing else on the rest of your body, if it stands out, if it's your ugly duckling, then that can be a sign of a skin cancer.
Something that comes up very quickly?
Yes. So some skin cancers pop up very quickly. They grow and they change, week by week or month by month. They get bigger. Then that can be a sign.
How can you tell if a mole on your body is a skin cancer or not?
Lots of different ways. So the ugly duckling sign is one way. We also talk about the A, B, C, D, E's of melanoma, which help you to look at a mole and decide if it meets those concerning features. So A is for asymmetry, if one half doesn't look like the other half. B is for border, if the border is scalloped or irregular. C is for color, so if a spot has multiple different colors, if it's brown, black, pink, and white, then that's concerning. D is for diameter, so if it is bigger than the diameter of a pencil eraser, or about 6 millimeters, then that needs to be looked at. And I think the most important is E, which is for evolving, meaning it's changing. If it's something you've had for a long time and all of a sudden it's changing, that can be a worrisome feature.
Can, if you see a skin cancer just starting, do you burn that off or do you cut it off?
It's a great question. So there are lots of things we can do. If I look at something, or if a dermatologist looks at something and is concerned it's a skin cancer, we will usually do a biopsy and sample it.
Well, on the screening day, will you do that, or do people have to come back?
We have a system in place to get you to come back. So if a spot is found that is concerning and needs further treatment, we'll get you into our clinics quickly.
Give the date and time again.
So May 23rd. From 3 to 6 p.m. at Ellis Fischel Cancer Center.
And it's absolutely free of charge.
Absolutely free of charge.
Thank you, Dr. Emily Smith. Pleasure having you here today.